Hi everyone, my name's Daryl. So back in September of 2019, I was diagnosed with Guillain-Barre syndrome. It's abbreviated GBS. Then in December of 2020, I was re-diagnosed with CIDP. So as you can see, I'm being administered my IVIG medication right now. Unfortunately, I'm getting the medication administered 2 days late. So I thought this would be a good time and an opportunity to go over the steps that you need to take to ensure that you get your IVIG medication administered on time. Also, May is Guillain-Barre syndrome's awareness month, and so I really didn't want to miss the opportunity to do a video during that month. And so let's get started. Typically, you need 3 things in place in order for you to get your medication and to get it administered. You need a prior authorization, you need an updated doctor's prescription, and you also need nursing orders. My specialty nurse doing the administration of my IVIG today likes to think of it as a hierarchy or a pyramid. And at that very top of the pyramid is the prior authorization. The prior authorization goes to your insurance company and basically lets them get the medication approved and delivered to you. And typically it's good anywhere from 6 months to a year. Basically, it's documentation, it's test results that support the diagnosis that your doctor made. So the second piece of the pyramid is the prescription. The prescription is basically your doctor's letting the insurance company know what medication it is that he wants you to take as your treatment, including the dosage of the medication as well as the frequency. Typically, doctors write the prescription for about a year. I don't think most insurance companies will let doctors go for more than a year. It could be the case, though, that insurance companies might make that updated prescription a little bit sooner. So they might say that they have to have updated prescriptions every 6 months. But once again, that would depend on the insurance company. This is a very important date also to keep track of, because if you don't have an updated prescription, like I didn't, then you're not going to get that medication delivered to you. So lastly, and at the bottom of the pyramid, is this thing called nursing orders. So the nursing orders are basically the doctor telling the nurse that's doing your infusion how to do the infusion. So it can include things like the pre-meds that your doctor wants you to take, the infusion rate that your doctor wants the nurse to use, whether or not to check for certain side effects, to check blood pressure at certain intervals. So basically it's the treatment plan for the nurse from your doctor. Once again, this duration of these nursing orders and the expiration date can change from company to company. Credo, I believe, requires the nursing orders to be updated every 6 months. So basically you have all of these different requirements, and it can be very confusing for the patient. So you have the prior authorizations, you have the prescriptions, you have the nursing orders, and each of these could actually have a different expiration date. One of the suggestions my nurse made to me was when I'm doing my call to order the medication. So I don't know if every patient is gonna once a month call up the pharmacy to order the medication, but in my particular case, I have to call a Credo once a month to order my medication. During that time, I can simply ask the customer service rep if there's anything coming up that might be delaying any of my shipments or my medication, such as the nursing orders, the prescription, or the prior authorization. And if you get a really good person on the phone, they'll tell you, oh yeah, this is gonna expire soon, next month or the month after, and then you can make sure that you get an appointment with your doctor, or at least call your doctor just to make sure that he knows about it. So I know it really sucks to have to be in the middle of all of this. You would like people just to do their job, but unfortunately, things do slip through the cracks. I have a really good doctor, has a really good back office staff. They do a really good job of keeping track of things and making sure that everything gets approved or gets sent to the insurance company or the pharmacy. But this slipped through the crack. And sometimes there's really nobody to blame. But oftentimes you're there to help kind of grease those wheels. So for instance, my medication was supposed to be delivered to me on Thursday and it wasn't. So on Friday, I was inquiring about what was happening, and that's when I found out that I didn't have an updated prescription. So right away, I called my doctor, got them on the line, and I was talking to them and said, hey, would you mind if I also call Accredo at the same time and get them on the line? So a patient can't do anything for himself, right? The patient can't tell the pharmacy or tell the insurance company to do something. That has to come from the doctor. But if you can get on the line and be the middle person between those two, making sure that everybody's on the same page, that can often streamline things and get your treatment on time the way you're supposed to. So one of the things also to be aware of, if there's ever any change in your treatment plan, for instance, let's say you switch medications, let's say IVIG, maybe a particular brand isn't working for you anymore and your doctor wants you to change brands, that's gonna start the whole process over again with prior authorizations and updated prescription and often updated nursing orders. If your doctor simply changes the frequency that your IVIG is going to be administered, or maybe the dose, so you go from 60 grams to 70 grams or whatever it is, maybe because you gained some weight or lost some weight, that also is going to require an updated prescription, updated prior authorization, and maybe updated nursing orders, but maybe not. So just keep this in mind. Whenever there's a change in your treatment plan, understand you are going to have new dates and you might have a little bit of delay in getting your medication. But work really closely with your doctor so when you do make these changes, you do it right at the beginning of the cycle. So hopefully this can all get approved before your medication is scheduled to be infused. So before I became a professional patient, I really didn't pay all that much attention to deductibles and max out-of-pocket expenses and preferred medications and all these other things that now I'm really familiar with. But it's really important that you keep track of those things. It's important that you understand when your plan year rolls over. So typically once a year, your plan gets sort of reset and you get new deductibles that you have to meet and new maximum out-of-pocket expenses that you also have to meet. So for instance, before I had, I'll talk about the copay assistance program in a second, but before I had copay assistance, I would have to pay out of my own pocket until I met my maximum out-of-pocket expenses for my IVIG medications. And so I knew basically my fiscal year was actually when my year rolled over. So every July 1st was when the year rolled over. I knew every July 1st I was going to have to pay about $6,000 out of pocket, which really sucked. So it's really important that you also know these fiscal year dates or these calendar year end dates, because this is often when patients have the most problems in getting their medication because, something happened at that fiscal year or calendar year rollover of your insurance. So since we're on the topic of deductibles, max out-of-pocket expenses, copays for your medications, you should know about copay assistance programs. So many manufacturers of these really expensive specialty pharmacy medications, a lot of times they have copay assistance programs for patients in helping to defer some of those really expensive costs. Now, I found this really nice PDF document that covers some of the current manufacturers of IVIG products that have copay assistance programs. So you'll probably want to take a look at that. I'll put that on the screen and show you the web address. I just did a quick Google search and found this. There might be some updated documents that maybe have more information, but this is just one document that I found. Oftentimes, however, insurance companies actually don't allow you to use copay assistance programs. My insurance company doesn't. So my insurance company uses Express Scripts as their pharmacy manager, I think is what they call them. And Express Scripts for their specialty pharmacy use Accredo. So there's just things to be aware of about the names of these things that are used as insurance company lingo, I guess is what you could call it. Both Express Scripts and Accredo have a relationship with this company called Save on SP, which I've used them in the past and they kind of didn't work out so great, but this year it's working out terrific. So I haven't had to pay any copays to get my medication. And so I'm really happy about that. So it's really saved me a bunch of money. So really pay attention to any copay assistance programs that could be available to you. Also give your insurance company a call, or whoever manages your benefits a call to see, what it is that you can do to help defer some of those really expensive copays. So that's it. I really hope you found this information useful. It's kind of really some basics, but especially if you're a brand new patient, I wish I would have known some of these things in advance. It would have made my life, really a lot easier. But if you did find the information useful, please consider subscribing to my channel. Also, please give this video a like, which makes it a lot more likely that YouTube's gonna send this video out to more folks. And I think that would be terrific. So I hope to see you again in the next one very soon.
I've seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago, but all will be okay. I move on each and every day. The past is where it stays, way back a year ago.